My name is Elyse Wild, and you are listening to Women's Lifestyle Magazine, Inspired Voices. Hi, welcome back to Inspired Voices. I hope your week is going well. Today, I am going to be talking to Megan Zambiasi, who is the Senior Director of Clinical Services at Restst Christian Mental Health Services. So as coronavirus persists, there are obviously major physical health concerns, especially for those in our community who are a part of vulnerable populations, but there's also major mental health concerns. This is really hard to deal with. At the outset of this, I think it was a little easier. There was certainly some anxiety, but as the weeks go by, and what are we now in week 4 or week 5? It's hard to keep track of time. It becomes more and more difficult, and as we're further removed from our routine, it can be really hard to deal with the anxiety and the depression of what's going on right now because we don't have those coping mechanisms that we used to have, that we maybe didn't even recognize as coping mechanisms, like the drive to work or interacting with your coworkers or grabbing a cup of coffee or if you're at a coffee shop, going out to lunch. There's all these ways that we interact with the world that I think soothe us mentally, and because those things are a part of our routine, we maybe don't recognize them as coping mechanisms. So as time goes on, I know I'm certainly having a harder time than I was a few weeks ago. I've had some really good days and then some pretty bad days where mentally I'm just really struggling. And I talk about that with Megan and kind of shed some light on that and how I'm coping with that. But rest assured, if you are struggling like I am, there are many resources to get help. Restst has really thought ahead. They pivoted very, very quickly. They trained a ton of their staff to be able to handle this potential mental health crisis in the best way possible. And they did it all really quickly. So I was really impressed with the fact that they had the foresight to do that. So there are those resources outside of your home if you really feel like you need some extra support and some extra help. And Megan and I also discussed things you can do on your own and that you should implement on your own to soothe yourself and to help yourself better deal with the repercussions of this. Throughout the life of this podcast, we're going to keep introducing episodes that address the mental health of all of this because it is not a one and done deal. I personally need to be reminded, and having repeated discussions about taking care of my mental health really helps me to do that. So I hope this episode helps you if you're struggling. If you're not struggling, that's amazing. Good for you. And I hope that it just helps you, gives you the tools to look out for yourself as we continue through this pandemic and to help others in your life who might be struggling. So here we go. I hope you enjoy it. Okay, today I'm joined by Megan Zambiasi. Megan is the Senior Director of Clinical Services at Restst Christian Mental Health Services. Megan, you've been at Restst for nearly 20 years. Can you start off by telling us what drew you to mental health work in the first place?
Sure. Thanks for having me on, Elyse. I really like people, and I like to understand what makes them tick. So years ago, psychology was just sort of a natural place for me to find a career. And as I began working, I found that sitting with people and being there in the times where they're really struggling and having difficulties was something that was meaningful and rewarding. So that's how I landed in this field and have been here ever since.
All right. So I just thought of a question while you were describing what drew you to mental health work. What is something that has significantly changed in the past 20 years in mental health? From my perspective of someone who, I'm not a professional, but I have my struggles with depression and I've had treatment. And it seems like, from my perspective, that dialogue around mental health is becoming more mainstream, slowly getting there. But really the past couple of years, it feels like it's picked up.
Yeah, I actually, that's almost exactly what I would have said, Elyse, which is I feel like in the time that I've been practicing, I really have found that people are much more open about any struggles they may have. And while we still have a long way to go, it's much more acceptable now, thankfully, to be able to say, hey, yep, I struggle with depression or anxiety or others, substance use. disorders, other things like that. And oftentimes you'll find another person who nods and says, yeah, I've had that too, or my family member has, and we're willing to acknowledge that. And, kind of bringing that out of secrecy, I think has only helped improve our health outcomes in general. So that's actually a really positive development.
That's great. That's great for sure. That's what it seems like from the outside. So
Yeah.
we're in the midst of a global pandemic. As hospitals have prepared for surges in patient volume, Pine Rest has also prepared for a surge of community members who may need your services. Can you tell us a little bit about how you guys prepared for that and what kind of gave you the impetus to make those preparations?
Right. I think one of the things that happens as a result of any huge event like this, really, this is unparalleled. We've never really had a situation where pretty much the entire globe is dealing with an issue at the same time. Normally it's kind of a localized thing, probably in our lifetimes, the 9/11 occurrence is one that would be an example that, yes, it impacted a lot of people, but it was also pretty localized to the United States or other places. And in any case, with that kind of situation, I think that we at Pine Rest realized that we were going to have probably a lot of people needing services. The feelings of anxiety and worry that accompany a pandemic, and that we've all pretty much been unprepared for. None of us had any kind of preparation for pandemics probably previously. I think of fire drills and other things that we probably have all done over the years in our workplaces, and not once did we ever prepare for a pandemic. So we began thinking pretty early when we could see that this was likely to start happen in the United States. We thought, okay, what will people need when in our community, and how should we have our services ready to serve them? So in our outpatient division, we began prepping for increased capacity for telehealth, which we've had, fortunately, for quite some time. But we hadn't really had quite as many people need to use it all at once. So we began adding some capacity there and training our therapists and psychiatrists and advanced practice professionals to move their practices online quickly. And that was one thing we did for sure. In the other settings, we added in extra safety protocols to be able to make sure that our patients coming to us in both our inpatient, our partial hospital programs, our urgent care center, our residential homes, that people could come there and feel safe, like we've been protecting them, and that our staff are screened every day and to be sure that they're healthy and safe as well. So all of those safety protocols, which are really pretty considerable, like any other hospital, we have the same things that are added in there. But we also did some things to ensure comfort for people. So we moved our partial hospital program, for instance, to a virtual platform so that people could access that, but also didn't have to come in necessarily for that treatment, and could use that from the comfort of their homes and not worry in the same way about that. We're really excited that we've been able to offer that. We've got that up and running just this past week, and I've seen some really good progress with that so far. In our inpatient units, we've taken extra care to be sure that if people need to stay with us for a time period because they're really struggling, that they have a very safe environment and that our staff are ready to help them. We're using some telehealth there too, just to minimize the number of people that go on and off units, which is a pretty common thing that's done in hospitals right now too. So we felt really good about that. In our urgent care center, we're fully staffed and ready to see people if they do need to come to us and walk in. We have safety protocols at the front, but we have those services offered at the very same hours that we did previously because we thought it was really important that people had somewhere to go in a crisis. So yeah, overall, we are up and functioning and ready to meet the community need.
Wow, that's great. It sounds like you guys kind of put together a comprehensive plan pretty quickly.
Yeah, it was really very quick, but we were able to do it, and the team certainly all came together and has been moving along ever since. We're just ready to serve wherever we're needed.
Now, have you guys experienced an uptick in patient volume quite yet to the degree that you were anticipating?
No, we haven't yet, but that's been pretty consistent with, I think, what's been happening overall in West Michigan is that, we were ready beginning in March, simply because we could see what was happening in the Detroit area. And I think some of the thoughts were is that maybe we would get the very same surge that would come to us. But fortunately, with the orders put in place by the governor, some of our numbers overall in West Michigan, while still, obviously high, and there have been some deaths and whatnot from the COVID-19. We haven't seen as much of a surge as the Detroit area has, or other areas of the country, but we're still anticipating. I think what they've thought is, some of the models indicate that perhaps ours will happen, but it'll be a little slower. Again, this is all pretty unpredictable. So far, I think, just like in the health systems, we've been able to manage and treat people as they come to us, and just ready to do what we'll need to do over the long haul here.
So I imagine that the common feelings in all of this, what people are experiencing, are anxiety and depression. It might seem pretty obvious, but can you give us a little bit of professional insight into why a situation such as this, such as a global pandemic, would trigger anxiety and depression? Also, perhaps in people who maybe have never really experienced those things before.
Right. Absolutely. I think I spoke about it a little bit earlier too, but the idea that no one has ever really been prepared for something of this scale, right? So many people who maybe have never had a behavioral health issue of any kind may find themselves suddenly extremely worried, or anxious, or sad. This sort of the governor's order to have us stay at home is really important to keep everyone safe, but it also has an element of social isolation in it that makes it very difficult for people, particularly those who may rely on connections outside of their homes for their socialization. And we begin to feel that. Human beings feel that really quickly, actually. If we don't have the support of others around us, we do tend to get anxious and depressed and sad very quickly. So those are things that people are now experiencing, just simply because they're not able to do their normal routine. You don't see the person at the coffee shop that maybe you chat with every morning, and you can't hug your family member perhaps because you don't want to give them something, or you worry that you might be possibly bringing something from your workplace or whatnot. All of that stuff just adds up and adds a lot of stress to people. And to top that all off, a lot of people are experiencing job losses. So there are financial difficulties that are part of this that are unprecedented. Mm-hmm. And that also adds to the feelings of sadness and anxiety and worry. And there's an element of grief and loss as well. I mean, grief over what used to be. I hear a lot from people like, gosh, I just wish I could go back to what it used to be like. I took for granted that I could hop in my car and go someplace, and that the grocery store shelves would be stocked, and that, I could hop on a plane and go on my vacation, and I didn't have to worry about any of those things, and now I do. So there's a profound sense, I think, just as a society, that we're just not as, now we have to think about things that we didn't previously.
Mm-hmm. And I imagine, when this is all over, whatever over looks like, it's hard to imagine what this being over looks like now, yeah. as we get further into it. But last night, my husband and I were talking about, when we're given the go-ahead that it's safe to kind of resume socialization, mm-hmm. and working back in our offices, and just being around other people, how is that going to feel? I mean, going to the grocery store right now gives me a lot of anxiety. It's a pretty scary thing to go. It's just something that used to be really benign errand, going to the grocery store, picking up food. Right. Now there's a lot of emotion around it, and I'm not sure that as soon as the government snaps its fingers and this is over and we have a cure, we have a vaccine, if those feelings are just going to go away. For me, I think I'm going to still have those feelings mm-hmm. around all this for a while.
Yeah, absolutely, Elyse. And I think you're not alone. I expect that most people will probably have some reticence about, mm-hmm. is it, I haven't done this now for a couple of months at least. And what does it feel like to go back out? And, am I suspiciously looking at everybody who passes me by? Are they 6 foot, away? All of those things that normally wouldn't have even caused us to pause will now, right? So we do expect too that we'll see more of other kinds of symptoms. We'll probably see some post-traumatic stress, particularly for those who maybe have either experienced the severe forms of this illness, or who maybe their family members have, and even, of course, people who unfortunately have died from this. That if you've had somebody in your orbit who was a victim of COVID-19, that might be very difficult for you, as you go through that. So, yeah, there's a lot of collective, feelings that are going to be happening in, probably the next year or two, that all of us are going to need to be prepared to, look out for ourselves and our family members and loved ones, and get them the help that they may very well need.
For sure, for sure. Another question I have is in regards to, I'm not quite sure how to phrase this. This social media, I suppose, is
Mhm.
a lot of us are now seeing people that either vehemently disagree with shutdown orders, or
Mhm.
um, I mean, it's just all over the place. And I think I've sometimes, I have found myself for the first time in a long time feeling the negative impacts of social media,
Mhm.
and really realizing like, oh, I need to really not, I just need to not
Mhm.
look at that. I need to not get caught up in
Right.
other people's opinions. Can you talk a little bit about that as a means of coping? Especially now, I think we're, many of us, as you said, we're furloughed or experiencing job loss. We're at home. I think people are on
Right.
social media way more than they were before this.
Right, absolutely. I think the issues with social media, of course, have been there for a while, in
Yeah.
terms of that it can be a wonderful platform for connecting, and it can also be a place where people, feel free to say whatever they need to say, and then some people don't edit very much, so it can be a lot of very strong opinions, and polarization on those platforms. Um, you know, it's interesting. I think the media right now, it can be difficult, especially for people who are feeling anxious about what's happening, which is probably most of us. So many therapists and professionals are recommending that we limit your exposure as much as you can to that. Not that you would put your head in the sand, or not know what's happening in the world, but understanding that too much of it, our brains can only handle so much information. And if you're constantly flooded with news, and right now a lot of the news is not very positive, right? It can be very overwhelming, and you may have difficulty coping then as a result. So we often tell people to think about maybe picking a particular news outlet that you trust, and logging on or looking at that maybe once a day, limiting your exposure in some way, so that you're not becoming too quickly overwhelmed by what's happening around you, and that you can focus on the day-to-day, which tends to be soothing to people.
Mhm. Would you also suggest perhaps maybe drawing boundaries in some relationships, where I think we all know a person or two who maybe the way that they cope is to take in as much information as they can, um,
Yeah.
but then sharing that with people who maybe that's the
Mhm.
exact opposite way of how they cope.
Right, right, right. I say frequently, at least, that one of the things that happens to people under stress, and in particular in situations like this, is that we all become a little more of ourselves. So whatever we tend to be, we're just more of that. That's good and bad, but people who maybe really find a need to know everything because they feel like maybe they can control their environment, they might be your friend or neighbor who feels like they need to give you every bit of every update that there is on the situation. And you have others maybe who get irritated, or as you kind of alluded to before, may feel like I need my freedom, and I hate this shutdown order, and, and so we all vary. Everyone handles this differently. So yeah, depending on where you are, you may need to draw some boundaries with people. I also have been, telling people it's really important to be very tolerant, as tolerant as you can be, of those around you, understanding that everyone does this differently,
Mhm.
and there isn't a perfect or right way to do it. So a lot of extra patience is required of yourself and of other people right now.
Yeah, that's a very good way to put that, is there's no right way. Um,
Mhm.
and me being able to remind myself of that over the past couple of weeks has really helped me kind of mitigate the natural judgment that comes
Oh yeah, yeah.
from that exact thought of like, oh, they're not dealing with this well. And it's like, well, they are. They're dealing with
Hmm.
it. I'm dealing with it. We're all dealing with it.
Hmm.
what is dealing with it well? We don't know that. We don't know
Right.
that. Like,
We don't. You're absolutely right. There's really no perfect way here, and most of us are good examples of that as we go through our daily lives. And this is going on several weeks now. So, for the first few weeks, probably we were all extra gracious and helpful, and now you're going to see us all. Even if you. The joke has been some of the memes on Facebook about people's haircuts and how we're all we're all looking pretty shaggy externally. We may be feeling that way inside too, where we've just about had it. People's nerves are pretty frayed at this point. So extra patience is definitely in order for all of us.
so what advice do you have for people on how to cope with this in a healthy way, how to cope with the extra anxiety and depression, and how to maybe recognize when we might need a little help beyond our own personal toolbox?
Yeah. I think, coping skills often are, some of the things I see people out doing actually are great. So I see a lot of folks out exercising. I don't think I've ever seen so many people
Yeah.
exercising in bad weather in Michigan ever, but
Uh-huh.
people are clearly, wanting to get out, which is excellent. So being outdoors and trying to take advantage of that is a good way for sure. I've also seen other people who pick projects, little things that they maybe have been putting off around their homes. And, the mastery is what we call this. The mastery of something actually can help you feel quite a bit better. So that's like when you
Yeah.
tackle a project that maybe you haven't done, and that feeling of satisfaction that comes from finally getting something completed. And that's also something you can control, right? So it's within your orbit, and that can help you feel calmer and better too. Reaching out to others, even if you can't be with people in person, and if you can, make it a phone call or a video call so that you can hear or see people and not just texting. The interpersonal connection, even if it is via technology right now, is really important, and human beings really need that. So all of those things, hobbies, music, art, things with your hands are particularly helpful and soothing. So whatever it is that you can do, uh, with your hands can actually be particularly soothing and helpful too. So go out and dig in the dirt, or knit something, or use a coloring book, or cook, or whatever. All of those things are things that typically people do and feel better when they're doing them. In terms of warning signs, I think that a lot of the things we tell people to look for are increasing feelings of sadness, or depression. So it can also look a little different. People often think of it as being like crying spells or whatnot, which could certainly happen. But also some people are really more irritable. They may find that they don't really they wouldn't label it as sadness, but they find that they're, biting everybody's head off, and they feel really cranky. That can also be depression. It just shows up differently in people. Um, sleepless nights often are a sign, or sleeping too much. People who just kind of shut down and can't seem to wake up for anything, and they're just kind of slogging their way through the day. That's those are signs that you may need to do something. Big changes in appetite are another. And of course, people who may be having thoughts of suicide, or hurting themselves in some way, those are very serious things, and we want to hear from you right away if you're experiencing any of those.
Mhm. So what I heard you describe a little bit there were the physical manifestations of depression, of the loss
Hmm.
of appetite and the
Hmm.
excessive sleeping.
Hmm.
And I think that unless it's something that you've experienced, or that you have some ancillary experience with someone in your life, you
Hmm.
might not necessarily recognize those as signs
Right.
of depression. And we
Right.
just really, at Women's Lifestyle, we just really want to make sure and get the word out, and educate people, because people might be experiencing these things for the very first time ever, um,
Hmm.
because of the situation that we're in.
Right, absolutely. And that's often why we mention those symptoms, is people don't realize that's what that might be.
Mhm.
So if you go in to talk to a counselor, or right now where they're going in, you're in telehealth, and they're asking you questions like that, that's because those are often the signs that we're looking for. Depression and anxiety have very real physical symptoms. Worry and panic and anxiety also can have the symptoms where you may feel like you have a need to be out and about or moving around a lot. You may have heart palpitations that are not otherwise explained, other things of that nature that can be indicative of anxiety too.
So for someone who has never been a patient of Pine Rest before, um,
Mhm.
who feels like they might need some help, how do they get in touch with you guys? How do they reach out? How do they get started on that pathway to help?
Yeah, we have several ways you can reach out. One of the things we find most often is a lot of people now go to our website and look for, different programs or things that they might be interested in. We have all of our phone numbers and links to things there. So if you're curious about that, that's a great place to start. We also have a phone number that you can call, and you can get somebody on the phone to talk with you and help you figure out what the right level of care might be for you. And all of those things are on our website at pinerest.org, and we can give you some good direction there too.
Great, awesome. There's one little personal thing I wanted to add about coping. You talked about people are exercising now, people are picking up hobbies, and in my life, I've had a little bit of, and I'm fortunate to still be working, so I still have 40 hours a week where I'm at my computer. Working
Nice.
on projects for my job, which is great. It's very fulfilling. I think I would have a much more difficult time if I wasn't working right now. But I felt a sense of kind of urgency about figuring out what works for me as far as coping. I'll take inventory of like, okay, how did I feel today? What did I do today? What time did I wake up?
Right.
How much did I exercise? Did I get outside? Did I read my book, or did I just scroll through articles on my phone? And I'm kind of have a mental list in my head of things I can do that work for me and things that don't necessarily work. So if I find myself doing the things that don't work or don't serve me well, I can say like, oh, I've done 2 or 3 of those things today. I need to shift over to the things that work, or else I'm not going to feel that great at the end of the day. And that's been really helpful for me.
Yeah, no, absolutely. I mean, a lot of people find a lot of comfort in a routine of some sort. And, for those people who maybe have had young children, they may remember that from if you've got little ones, that typically one of the easiest things to do is to have enough of a schedule for them because they like routine. Adults under stress are no different. And many of us right now are out of our routines because we're not doing our normal things that kind of, you don't even realize that that's what soothes you, is to that drive into work that you may normally hate might actually be kind of a comfort because it's your time to disconnect from work and get to home or whatever. So all of those things now are really important. And I think, I like, especially Elyse, as you're mentioning, there are some things that don't work very well for you. And if you go down that path, that you've got to kind of reel yourself back in. So I know a lot of people right now who've connected with a friend or a partner, and they have kind of an accountability thing going where they try to compare notes or connect and try to keep each other positive and on track right now. And I would add that into your list of things, which is sometimes it's helpful to be doing those along with someone else. I've been doing what I call a walk and talk with several of my girlfriends. And these are people I normally go on walks with in person, but right now we can't do that. So instead we have an arranged time, and then we get on the phone. And as we're walking, just not together. We're talking on the phone together and get to hear each other's voices. And it's, the next best thing for now.
It is nice to, I've appreciated the kind of the intimacy of Zoom. We're in each other's homes and we're looking right at each other. We're not at a bar or a coffee shop where there's other activity going around. So I've really enjoyed connecting with people that way. And it is nice now that when we ask each other, how are you doing? It feels like there's a lot of grace and room to really say how you're doing, when before maybe that was just a social nicety that we just pepper throughout our conversations. So that's been nice, a nice way to share too.
Yeah, it's definitely more genuine than it had been probably before all this, right? And I hope that's a tradition that stays with us for a while, actually.
Me too.
I have visions of people just being a lot more accepting of, it's okay to not be doing so great, and to accept that in others, and to be a good listening ear.
Megan, is there anything else that you'd like to say about what's going on in the world right now, or what your hopes for the future are, which you kind of just alluded to, is that we all, give each other some grace and kind of keep the genuine communication after this is all over?
Yeah, I guess I would say too that, after this is all over, I do hope that people remember that sometimes the impact of this kind of event, it may take a while to show up. So,
Yeah.
it's like almost like a delayed grief reaction in a way. Sometimes those things happen with people. So to be mindful of that in yourself and in the others around you, that some people may not manifest any symptoms at all until they feel like the pandemic has passed, and then they may have symptoms arrive then. So I think that we need to give ourselves a really long time to talk about that. And I do hope that the conversation about stress management and behavioral health in general continues,
Mhm.
and that we are more open about seeking that kind of help for ourselves when we need it, because that actually, it really improves our health overall. And that level of connection, maybe the connection you were just alluding to that we feel right now with each other, that's just really good for us. That's one of the best things we can do, is to reach out and to be present for each other. So I hope people do more of that in the future too.
Yes, me too. That was very well said. Well, thank you for joining us. We really appreciate Pine Rest and what you guys are doing for the community. I'm glad we're able to get the word out, and I hope that people, if they feel like they need help, that they reach out.
Yeah, me too. Thanks so much, Elyse. It was great to
Yeah,
talk to you.
thank you.
Thank you.
Thanks for listening to my conversation with Megan. I hope that it provided you with some tools you can use to take care of yourself right now. I really encourage you to come up with a way to measure your mental health right now. Create some metrics. If you're having a really good day and you're feeling good, write down how you're feeling, write down what you did. So you can use those things as coping mechanisms when you're having a bad day. And, if it feels like you're getting into a place where you really just, that kind of stuff isn't working and you feel like you need some extra help, and it's, your feelings of anxiety, depression are going on too long, or they're going too deep, please reach out to Pine Rest. That is what they are here for. And if you're feeling that way, it's normal right now. I think it's an appropriate response to feel anxious and depressed, or to feel whatever you're feeling. Pine Rest prepared for this, prepared for many people confronting mental health issues, whether they've had them before or not. So I hope that you don't feel ashamed for how you feel. I hope if you are struggling, that Megan's advice and her words helped you. Please reach out and get help if you need it. Thank you so much for listening. We will be having a couple other episodes coming up that address mental health. Like I said at the top of the show, it's not a one and done thing. And we really want to be here to help you and support the community in whatever way we can. And this is one that we feel passionately about. If you have any ideas for a podcast episode, or if you'd like to hear from someone we haven't interviewed yet, please reach out to me at elyse@womenslifestyle.com. That's Elyse at womenslifestyle.com. To stay in touch with us, please visit www.womenslifestyle.com and sign up for our newsletter. You can also listen to this podcast on YouTube. Our YouTube channel is Women's Lifestyle, all one word. I hope you are all staying healthy and staying safe, and thank you so much for listening.